how to bring a comatose love life back from the dead. What is up, sapiosexuals? Thank you for turning on Sex in South Beach with your girl, Dr. Sanjaya, America's sex educator. And I am so excited to have Susan Bratton in the house, a renowned sexual wellness expert. She is an authority in bedroom techniques and communication skills that put the spice back in your love life. So the sex situation we're getting into today is all about orgasmic activation. Let's go. How
Yeah.
do we do it?
Well, you you think about your pleasure coming from the tip of your clitoris or inside your vagina, but actually all of the tissue of your entire vagina and vulva, they are able to be activated by making a mind-body connection so that the entire pleasure center, which is everything, is orgasmic. And so there's your mons, your outer labia, your inner labia, your vestibule, the G spot that presents on the outside here around your urethral exit, inside the vaginal sphincter, up inside there, down at the bottom, across the mons, all of this, because what's underneath here is your 3 erectile tissue chambers. They're actually under all of that. It's not just that tip. That tip is 5%, 95%, that whole banana worth of erectile tissue we talked about earlier is wrapped around your vagina. And so there's legs and arms and sponges of all kinds. And when you stimulate those areas during self-pleasuring and partnered sex, you're sending new signals to your brain, and your brain's going, oh no, that feels good too, oh that feels good too, and it gets more and more and more pleasurable. So you want to be 62 and having the best sex of your life, you can start activating all these areas and spreading the pleasure. And the way that I recommend doing that is through using a series of 8 different types of pleasure tools for women, for female bodies, and 4 different types of pleasure tools for male bodies. Some of them stimulate the whole outer vulva. Some of them are clitorally focused. Some of them are focused on the G spot, which is not a spot, it's a big tube up inside the vagina. Some of them are focused on blended orgasm. And when you start, if you have like one toy you use that kind of gets you there,
Yes.
I want you to have all 8 types of tools that get you there in 8 different ways that activate the entire system so that everything becomes orgasmically pleasurable and you can start to have really incredible orgasms. And there's one tool I thought you might like to look at.
Yes.
This is my new wand. It's not mine. I just call it my new wand because I'm in love with it. It's called the Vim. All of these tools, by the way, are at orgasmiccrosstraining.com. So I have all different 8 type and all my vetted tools. But this one, my new wand, I love so much because this is like your mom's old massager.
Yes.
But it's brand new, German designed, multiple motors, super beautiful silicone that holds the lubricant on there. And what it does is they figured out how to have it penetrate into all that erectile tissue to
Wow.
get it engorged. So yes, it feels beautiful when you ride your orgasmic pleasure with your clitoral structure,
Right.
but it also feels good when in activating and awakening the entire vulval erectile
Region. Right.
complex. Exactly. So that's just one more tip because that's right at the stack where you're getting into the pleasure expansion. Because the more that you pleasure and self-pleasure, the longer you make your sex span because you're bringing that blood flow over and over and over, and pretty soon it gets faster and easier to do it, and it gets more and more pleasurable.
Absolutely. 100%. As my mama says, if you don't use it, you're going to lose it. And
Yes, mama.
yes, give yourself an orgasm. Start activating, getting all of your juices flowing in a really comprehensive way, not just this one way, makes me feel like this, but let's get all of the different parts, make it a comprehensive, holistic experience for all of your body parts that could potentially produce pleasure.
So the next is that as we age, even with hormone replacement using good lubrication, we are still aging, shrinking, and atrophying. And so what you want to do is you want to reverse the atrophy. And what happens when you're atrophied is a combination of things. You might notice one or two of these things, but they're all happening simultaneously. One is you might begin to feel that you're having incontinence, either urge or stress incontinence. You're peeing or you can't control it, or you're peeing on the way to the bathroom, you're peeing in your pants. And that's the number one reason that women end up having to leave their homes and going into assisted living is that, not falls, but
Wow.
actually incontinence, peeing. And so you've gotta stave that off.
Yes.
You've got to stay on it. You got to
Yes.
get on it and stay on it, because
Yes.
aging is happening and you're basically you've got your finger in the dike, and you got to keep your finger in the dike by continuing to take care of and reverse all of this incontinence. The second thing is loss of lubrication. The third is painful vaginal, penetration. The fourth is the shrinkage of and the sagging of our labia. The fourth or the fifth is difficulty achieving climax. You're having what's called sensation loss. It's harder and harder to have that orgasm. Those are kind of the five horsewomen of the apocalypse for the vulva. And then, of course, for men, it's loss of sensation, so nerve retraction because of loss of vascularization, which gives them sensation loss. They also have inability to get hard, to stay hard. They lose size. They're shrinking both in length and girth, and they're losing vascularization. So that's their main problems. It's all the same stuff. They've got outies, we've got innies, and that's what happens with us. So, and then they've got prostate problems as well,
Yeah.
and they've got nighttime urinary issues, BPH, et cetera, et cetera. So that's kind of the set of issues. And what you can do to reverse or to prevent it is this Gaines wave and Femi wave, acoustic wave or shock wave treatment. And what it is basically this little wand that makes a sound. It uses
Mhm.
sound waves. It generates sound waves, and it's applied over the vulva, around the vulva, and a tiny bit inside the entrance to the vagina in that introital sphincter, that little round muscle at the entrance that's so sensitive for us. And what that does is it ascends, and then it's applied to the penis and around the base of the penis and in the perineal area up into the prostate area. And that technology, the Gaines wave and the Femi wave, it does tiny little micro damage. You usually go in for a series of 6 over 3 weeks to 2 months. Go to gaineswave.com or femiwave.com, and they have a directory. You can look it up on the directory,
Okay.
and they'll tell you who your practitioners are in your area. There's lots and lots of doctors who do. They've got a very large doctor network. And what it does is it tiny little micro damage. It's very similar to how you build your bicep. You're lifting a weight and doing tiny little micro damage that then the next day, your recovery day, it heals and it builds a bigger muscle. It's very similar to that. And it does neurogenesis, so it's knocking plaque off the veins. It's stimulating new tissue growth, new vascular growth, new nerve growth, and it's reconstituting that tissue. What I love about FemiWave is that they do the Mons,
Yeah.
which is really the gateway to female ejaculatory pleasure. That's where you get a lot of the blood flow comes down through that Mons area, through that upper pelvic bowl area, not just from deep inside, but right down the front of your body. And
But you
it
guys missed that you talked a little bit about squirting, the female ejaculatory pleasure, but we do also release when we're also really excited.
Yeah. All women can ejaculate. Just as a man urinates and ejaculates out of his penis, a woman does too. We have the same parts in different order. So
Yes.
it's not urine. There's a muscle in your body that closes off the bladder and allows you to ejaculate from the fluid that's running down through your blood plasma into your Skene's glands, through the urethral canal, and it exits your body. And it's a very, very beautiful kind of orgasmic experience for a woman. It's very healing, nurturing, and it's also very empowering. So it's one of my very favorites. I have a program called Female Liquid Orgasm that my partner Tallulah Solis and I publish her work. It's an online program that teaches you the joys of G-spot awakening and female ejaculation, both solo and partnered. And I think it's, once a woman is reliably orgasming from clitoral stimulation, I think it's really one of the best next steps for her in her sexual maturation and
Evolution.
evolvement, her
Right.
metamorphosis into an even more sexually vital woman.
Yes.
So the FemiWave, just to finish it off, the FemiWave and the Gainswave, if your husband's having erectile dysfunction, you're having erectile dysfunction. You just can't see it to the level that you can see it from him because his presents externally. And FemiWave and Gainswaves, I have so many couples now who are going in together for their treatments, and they'll go and they'll see the reverse and they'll be like, oh my God, I didn't even realize how much function I had lost until I
Wow.
got it back. And so I love that. And then the next thing up on the stack is what I would consider to be like the cherry on the top.
Yeah.
But if you can afford it, either stem cells, exosomes, or PRP,
Wow.
that's injected into these erectile tissue structures
Mhm.
by your Gainswave and FemiWave doctor. They almost all do this too.
Oh, that's good.
And it goes in those structures, that spongy tissue soaks it up, and it brings in even more healing and growth factors. And it's like an accelerator on the Gainswave and FemiWave. You don't have to do it, but I'm giving you everything.
This was so informative, Susan.
I've got one more thing.
Let's go. Tell me.
Okay. So not everyone can go out and get Gainswave and FemiWave.
Right.
There may be not a doctor in their area. They may be embarrassed to get treatments. And so I always like to have I always have the good, better, and best. I always have the budget, luxury, and deluxury, you know?
I love it.
So there is a product, it's called the Vagina Device. It's at vaginadevice.com, and this is a woman-owned company. And basically what they do is they have this intravaginal device so it goes inside the vagina. So it's not going to fix the outer labia. It's not going
Right.
to improve your clitoral sensation, but it is going to fix the vaginal pain, some of the odor that comes from loss of glycogen, from estrogen decline. It's going to help with the pelvic floor muscles and the incontinence piece of it. And what it does is it uses 3 modes. It has red light photobiomodulation, red light therapy that goes in the vagina, which
Okay.
stimulates mitochondrial development, which helps generate new glycogen stores because your good bacteria eats glycogen. And
Right.
you want to feed your good bacteria. The next thing that it has is warmth, and the warmth helps with the recollagenation of the vaginal mucosal lining, because when it gets thin, it gets lax and it's kind of open, and you don't have the grip you used to, which you need to help you with your orgasmic contraction.
Right.
And also with just pleasurable sex, your husband's penis in your vagina, if he's getting smaller and you're getting bigger from laxity, you don't feel the pleasure that you used to. And then the third piece of it is vibration, which is a Kegel toning strategy. And one of the things that I also like about this vagina device is that I use it a lot of times in the morning, the night before I know I'm having a date with my husband, because what it does is it brings a lot of blood flow into the whole vaginal canal area. And so it begins to engorge and fill that tissue with blood so that my intercourse feels even more pleasurable. So the combination of the Euphoria melts and the Awaken arousal oil with their sex oil on top and the pre-engorgement and the slow warm-up makes my penetrative lovemaking very orgasmic.
You talked about so many wonderful things, the mind-body connection. I love this orgasmic cross training. It's like, I always say cross training is like a cult. You go to one of those things, they're so intense. It's like, lift the weight, drop it down, run fast, throw a ball against the wall. So if you're serious about getting these orgasms, making them explosive as you age, making them better than you've ever had before, then you really, really probably want to check out this orgasmic cross training. All right, y'all. You know what time it is. It is time for your climax, where I give you a little something to remember about how to increase your sexual vitality as you age. 1, orgasmic activation. Make sure that all of your pleasure parts are getting revved up and prepped for a really fulfilling, satisfying, sensual experience. 2, don't forget to check out the FemWave, GainsWave, and the Vagina device. Susan brought you in an intervention for every economic phase. So regardless of where you are with your budget, there is a way for you to enhance your pleasure using these therapeutic natural advances. And when I say natural, this isn't a prescription. This is a way to work out your pleasure parts so that you can extend your intimate pleasure. And if you want more of Susan, where can everyone find you, Susan? Please give us all your handles, your website, everything.
Yeah, the best place to find me is at betterlover.com. You can sign up to my newsletter there. And then if you have any questions anytime, you can hit reply and I'll personally respond to you. So betterlover.com is first. And then if you want to follow me on Instagram or any other location, it's my name, Susan Bratton.
SusanBratton. And for your daily dose of Nookie knowledge, follow me on all of the social media platforms. That's TikTok, Instagram, LinkedIn. Come on, you want to link up. Guys, I had so much fun talking with Susan about how we can really age into our sexual fierceness. You are not past your prime yet. I had so much fun talking to you guys today, and I cannot wait to do it again next time. Thank you for tuning into Sex in South Beach, where everyone comes for a happier, healthier sex. Thank you so much.
Don't you deserve great sex? Turn on the Sex in South Beach podcast to level up your love life. Sex in South Beach, hosted by Dr. Sanjaya, America's only Ivy League educated sexologist and medical professor at the University of Miami. Find Sex in South Beach wherever you listen to podcasts. Sex in South Beach, where everyone comes for happier, healthier sex.